then Acha Sneha, Pravicharana Sneha, then Abhyantara Sneha and Bahya Sneha on the basis of mode of administration, Abhyantara Sneha and Bahya Sneha. Okay. Today's session, this syllabus points are indication and contraindication of Snehana, importance and method of Deepana, Pajana and Rukshana before Snehapana, then role of Agni and Koshta in Snehana, different matras, then procedure, main procedure, Anupana, Jirna and Jirimana Lakshana, Samyak, Adyoga and Ayoga Lakshanas, then Sneha Vyapat and management, also Sadhya Sneha, Shamana Sneha, Brahmana Sneha and Avapida Sneha. Today this much topics are there. Okay. I hope you are already familiar with these last day's topics. Then only we can understand what I am telling today. First is the indications of Sneha. The quotation is Svedya Samshodya Madhya Stri Vyayama Asakta Chindaga Vrittha Bala Abala Krisha Ruksha Kshina Asra Redasa Vadartha Syanda Timira Daruna Pradibodhida Snehya. These are the conditions in which Snehana is indicated. First condition is Svedya and Samshodya. Okay, we can tabulate it as like this. As Purva Karma. Those who are indicated for Svedana and Shodhana procedures must do Snehana. And then according to age, Vrittha and Bala, only they are supposed to do this Sadhya Snehana. Anyway, they are indicated. Then in different viharas like Vyayama Nitya, Stri Asakta, Chindaka, Madhya Asakta, and then in different diseases. In these conditions, Vyayama Nitya, Stri Asakta, Chindaka, etc., Vada Prakopa is the main factor. In the last class, we have already discussed that Dosha Pradhanasya, Vadasya, Pradhana Peshajatvat. Sneha is the best tool or treatment to reduce or alleviate this Vada dosha, Vada Prakopa. So it is indicated. Then coming to different diseases, you will study in Kaya Chikitsa topic that Vada Vyadi, Kshina Rakta, Kshina Redasa, Abhishyandi, Timira, Daruna Pradibodhana, that is difficulty in awakening. That conditions Sneha is indicated. Then according to constitution, Ruksha, Krisha, Abala, there also that Rukshada of Vada is more. To counteract that, Snehana is a must. Next coming to contraindications. Natu ati mandakni, Tikšnakni, Sthula Durbala, Urustamba, Atisara, Ama, Galaroga, Garodare, Morcha, Chardi, Aruji, Sleshma, Trishna, Madhyescha Pidida, Abaprasuda, Yuktecha, Nasyam, Vastau, Virejane. This is the sloka from Ashtanga Hridaya. Then coming to the explanations, first is Rukshanarha, that is in Rukshanarha patients that Kapha and Medas will be more and Abhishanda is in extreme condition. If we do Snehapana in that condition, complications, Sneha Vyapat may occur. So the first treatment line should be Rukshana to that patients. Okay, that is Mamsala Medura. I will be dealing later in that quotation. Mamsala Medura Bhuri Sleshmano Vishamaknaya. In that condition, Rukshana is the first and foremost treatment, not Snehana. Then coming to this Taruna Jara, Udara, Uristamba. These all are mentioned by Acharya. Here, if we do Snehana, it causes Strodhorodha. That is why it is contraindicated. Also, Ama and Agni. Here, the Agni status will be low, weak, and they cannot withstand this Snehabana. We are giving this increased dosage, then they can't afford that Snehadravya. And it also causes Srodhorodha. Then Durbala. Due to weak Dadus, they cannot tolerate the high amount. So we can either go for Vijarana or Sadhya Sneha. Vijarana will be best. Then Chardi, Aruji, Ajirna, Annadvesha. Here also that Srodhorodha, thereby that Agni status will also be weak in that patients. Then coming to Datta, Vasti, Vamana, Virejana. In these patients, already their body is weak by this Shodhana procedures. Then again, if we do Snehapana, it will not affordable to them. Then administration of sneha during akala and durdina. Akala means for this shodhana and shamana snehapana, some time of administration is given. Like, for example, in Shodhana Snehapana, Hestane Jirne, that is, when the previous night's meal get digested, we should give Shodhana Snehapana. And in Shamana Sneha, Kshuddvado Ananno, when the patient have good appetite and that previous meal also get digested, in that time we should administer Shamana Snehapana. If we are administering in irrespective of this time, that is akala, it may cause complications or it cannot produce our therapeutic effect, what the desired effect of ours. And durdina means we can correlate it as a cloudy day. Here also, the kapha dosha will be more predominant, and this sneha is also kapha predominant one, sniktha gunanu. Then that kapha will be more aggravated and complications will occur. The digestion of ghee, that sneha jirna lakshana will not occur. Okay. These are the indications and contraindications. Next, coming to determination of Koshta and Agni. Okay, I am giving you the lecture as a point by point. Then only you can uh, look on it later also. Okay, you must write it down. Okay, take a notebook and just note it, not full points, just point by point. Okay. That first indication I told, then contraindication, then coming to determination of Koshta and Agni. These are the two main factors that we must be very careful before doing Abhyantara Snehapana. First one is assessment of Koshta. You know, Koshta is the nature of bowel habit which originates when on the conception itself. Okay, at the time of the conception itself. Anatomically, we can say it as viscera, that is, Koshtangas are mentioned. And physiologically, it is Koshtagni, it is the digestive faculty in our body. According to the predominance of dosha, it can be classified into mrudu, madhyama, and krura. You all are aware, no? Koshtaha kruro, mrudur madhyaha, madhyasya taihi samairapi. Then, according to Acharya Susruta, some difference is there. Mrudu Koshta is Bahu Pitta condition, Krura Koshta is Bahu Vada Kapha condition. Vakpadacharya and Charagacharya have mentioned it as simply Vada. Bahu Vada condition is Krura Koshta. But Acharya Susruta have mentioned that Bahu Vada Kapha condition is Krura Koshta. Then coming to Madhyama Koshta, it is Samadosha by Susruta Acharya. Then how is the assessment of Koshta done? Coming to Mridu Koshta, here the involvement of Pitta is more in Grahani and less Kapha and Vayu. Okay. Then in Charagam Sutra, it is mentioned as if a person purgates easily with milk, sugarcane juice, sour buttermilk, wine, fresh wine, etc., that person is considered as a person having Mridu Koshta. Then Madhyama Koshta, it is another name is Sadharana Koshta. It is due to the presence of dosha in Samavastha, that is equilibrium condition, or due to Bahu Kapha Avastha. Then it is the Krura Koshta. Here, I have already told that increased Vada or Vada Kapha in Grahani. That condition is Krura Koshta. It is Durvirechya by Sushrutacharya. These type of persons do not respond to Virejana with Draksha Rasa, etc., but also gives purgation with very difficulty with Tribhala, Trivrit, the okay, fruits of Nilini, etc., other Virejana, other most Sreshta Virejana Dravyas. This is one of the study that is open label single arm experimental study to standardize dose of milk in assessment of cost. I have just added that is they have done by standardizing the dose of milk needed for the assessment of Koshta in healthy volunteers. That is, in this slide, I have told that in Mrudu Koshta, it gives purgation even with milk. So they conducted this study to standardize the dose of milk. Okay, and they came to the conclusion that the dose of milk needed to cause purgation in Mrudu Koshta was 500 to 600 ml, and for Madhyama 600 to 700 ml, and Madhyama Tama was 800 to 900 ml, like that. But the dose of milk needed to cause purgation in Krura could not be elicited. And also, this Susrudacharya told, no, it is their Duruvirejya, and this statement was supported by this study. Okay. And this one, assessment of Koshta with special reference to Abhyandara Snehana. Dr. Vasansi Patil have done this research. And these are the points to be noted while we assess the Koshta of a patient before Abhyandara Snehabana. These are frequency, frequency of the stool, consistency of the stool, straining efforts, time taken for proper defecation, lightness and satisfaction after defecation, previous encounters of diarrhea and constipation. Okay, we will be asking some questions, like questionnaire will be there, and relating to Krura Koshta, that frequency will be like doesn't pass stool regularly. Consistency will be hard and dry stools, and considering this training efforts request more training, and time for defecation means requires long time for defecation in Krura Koshta persons, and the unsatisfactory bowel clearance, that is Krita Sapnya, Akrita Sapnya will be there, and rarely encounters diarrhea and more frequently constipation, requires drastic purgatives, no change in the bowels by test dose of Sneha. If we give test dose, no, there will be no change in the bowel. Coming to Mrudu Koshta, passes stool daily once or twice regularly. That is the frequency. And the consistency will be semi formed or formed stools. Then easy defecation, less time required for defecation, and lightness after defecation. Previous encounters of often watery stools due to hot drinks, tea, milk, like that. Then minor laxatives easily induce diarrhea, and after the test dose of Sneha Dravya, they passes loose, slightly loose stools, and frequency will be more even after the test dose. Then coming to Madhyama Koshta, they passes stool once daily. The consistency will be formed, and it requires minimum strain. Also, little long time when compared to this Mrudu Koshta, and lightness and satisfaction after defecation will be there. Doesn't often encounter this diarrhea or constipation, requires medium dose of purgatives and laxatives, doesn't purge by hot milk or minor laxatives. Also, after the intake of test dose of Sneha Dravya, they pass as semi-formed or formed stools once or twice. These are the three Koshtas assessment. Okay, according to this, frequency, consistency, straining efforts, then time taken for proper defecation, lightness and satisfaction after defecation, then previous encounters of diarrhea and constipation. Also, I have added the test dose. After giving the test dose, what is the change in the bowels? So, what are the changes in the bowel? Then Koshta versus Snehapana. You know, त्र्यहमच्छं मृदौ कोष्ठे क्रूरे सप्तदिनं पिबेत् सम्यक् स्निग्धो अथवा यावत् अतः सात्मी भवेत् param. That is, for Mrudu Koshta, it takes 3 days. For Madhyama Koshta, it takes 5 days. And Krura Koshta, 7 days. Also, this is the opinion according to Vakpadacharya. And Delhana divides this Koshta into Taratama Bheda. Mrudu Tama, Mrudu Tara, Mrudu. That is, it takes 1, 2, 3 days. And because Mrudu Tama means most superior Mrudu Koshta, it will take only 1 day for Sammik Snigdha Lakshana to appear. And then Madhyama Tama, Madhyama Tara, Madhyama, it takes 4, 5, 6 days respectively. And for Kruratama patients, 9 days is needed. That is the viewpoint of Delhanacharya. Next, in case of Mrudu Koshta, if we give Uttama Matra Sneha, it causes Agnimandya, Dravamala Pravarti, etc. Already the Mrudu Koshta patients are having this Dravamala Pravarti normally. If we give this Uttama Matra Sneha, these are the complications. And if in case of in Krura Koshta, if we use Madhyama or Hraswa Matra Sneha, it will not produce Doshotklesha. Okay, it will just digest only. What is the applied utility? Okay, this I have already told, that is the applied utility to determine the days. Okay, the days of the duration of Snehapana depends upon this Koshta. You just note it down. Okay, duration is depend upon this Koshta. Krura Koshta 7 days, Mridu Koshta need 3 days, Madhyama Koshta need 5 days. Next is the assessment of Agni. Okay, first Koshta assessment and then Agni assessment. Arunadatta, commenting on Ashtanga Hridaya Sutra, Snehadhyaya, he tells that, he points out that the administration of Sneha without the consideration of strength of Agni is irrational. Okay, we must be aware of this Agni Bala. According to Charaka, this Agni assessment depends upon three components. In Vimana, Charaka Vimana, we have already learned, that is Abhyavaharana Shakti, that is capacity to eat, Jarana Shakti, capacity to digest, and Ruji, appetite. Unless all are considered, no proper assessment of Agni can be done. And a study was done by assessing this three, Abhyavaharana Shakti, Jarana Shakti, and Ruji. Okay, for this Agni assessment. Then by Varsha Badwe, Agnibala index was found out. It was an assessment of Agni Deepti, intensity of biological fire. That is one index was, Agnibala index was formulated. I will tell. First, we must find out this Apyavaharana index. That is AI. It is the test dose by given dose per day. That is TD by GD for the first day. If we are giving 30 ml of Sneha in the first day, then the test dose will be 30 and that given dose in the first day will be also 30. Then 30 by 30, that is 1. In the first day, this test dose will be equal to the given dose. If this Abhyavarana index is more than 1, then it indicates the decrease of Abhyavarana Shakti. And if it is less than 1, it shows the improvement of Abhyavarana Shakti. From this Apyavaharana index, we can come to this Agnibala index. That is, test dose by given dose per day is the Apyavaharana index. And if we multiply this Apyavaharana index with the time taken for digestion of ghee, we get the Agnibala index. For example, in a person, 30 ml Sneha digests in 2 hours on the first day. First day, we are giving 30 ml Sneha to a patient. Then 30 ml Sneha digest in 2 hours. So what will be the equation? Test dose, that is 30 by 30 first day into time taken is 2 hours. Then that is the Knibala index will be 2. Next day we will be giving little more dose. Say it will be 30 by 60. 30 is the test dose, given dose is 60 and time taken will be 2 hours itself. Then Agnibala index will be 1. Third day, if we give 120, it will be the Agnibala index will be 0.75. And then coming to this last day, it will be 0.6. Like that, if the interpretation will be lesser the Agnibala index, more will be the Agnidipti. Okay. Therefore, this Agnibala index is taken as the scoring system for determining Kshuddha Pravarti, onset of hunger. Okay, that is test dose by given dose. Abhyavaharana index was calculated by test dose by given dose for the first day, and by multiplying this Abhyavaharana index with time taken for the digestion of ghee, we can calculate this Agnibala index. If the Agnibala index is coming lesser, then the Agnibala of the patient is getting increased. If it is coming more, there some our dose is something mistaken. Okay, I think it is clear. Then coming to the applied utility of Agni, it is used for the fixation of trial dose. That is, Yatha Agni Prathama Matram Payet Vichakshana. First, we are giving this test dose or trial dose to determine this Agni Bala. Also, The Agni is used for increasing the dose of Sneha on subsequent days and for achieving optimum effective Snehana within the shorter period. These are the assessment of Agni assessment. Then coming to which Sneha and Sneha Bhaga. This slide we have discussed in the last class. Sarpi Sharadi Padavyam Tailam Pravrashi na Atyushna Shidale Vasamajjacha Madhavi. That is which Sneha in which Kala we must select. Kashyapa has mentioned Sarpi is the best for all season. Also in Shida Kala, in Vadagaba condition, we must consume Sneha in Diva time. In Ushna Kala, in Vada Pitta condition, we must consume it in Nishi. Okay. Then coming to Sneha Paga, Acharya Charaga, Vakpada and Sharngadara have mentioned Madhyama Paga, but Sustruda have mentioned which Paga? Mrudu Paga. Okay. Just go through this slide. Next is dose of Sneha. Okay, we have discussed about indications of Sneha, contraindications, then determination of this Koshta, Agni, and which Sneha we should use, and which is the Sneha Bhaga. Okay, then coming to this dose of Sneha, Sneha Matra. The dose of Sneha is depend on this Koshta, Agni, Bala. And if the Sneha is less than the required quantity, we cannot get the desired effect, that is the Utklesha, will not occur. Then Sneha in excessive quantity means it causes Adhisnigdhata or Ubadravas. This sloka is important. Amatraya ahido akale mithyahara viharatah sneha karodi shofa arsha tandra stambha visapnyata pandu kushta dwara utklesha shula anaha pramadigan. If we consume without considering this matra, amatraya ahido akale mithyahara viharata, if we do this much uh, complications, this shofa, arsha, tandra, stambha, kandu, kushta, etc. will occur. Brahma also occur. So we must consider koshta, agni and bela of the patient. In the introduction class, you have studied that Samiksha, Dosha, Aushada, Desha, Kala, Satmya, Agni, Sattvadi, Vayobalani. This sloka you must be in mind and we must apply in your clinical practice also. Okay. In every procedure, we can apply this sloka. Also, Susrutacharya mentioned that Pidohi Adi Bahu Sneho Janayet Prana Samshayam. That is, without knowing this Agnibala or Koshta, if we consume, if we administer more, a huge amount of Sneha, it will cause the death of the patient also. Another one is about Koshta Ajnada Koshtehi Bahu Kuryat Jivita Samshayam. Without knowing the Koshta, we are giving this much of ghee, a huge amount of ghee. The prana will be lost. The patient will die. Next is Snehapana Matra according to different acharyas. I have gone through the syllabus points. Okay. As per the time required for the digestion of Sneha, it can be classified into Hraswa Matra, Madhyama Matra, Uttama Matra. Hraswa Matra means the dose of Sneha which digests within 6 hours. Madhyama Matra is that which digests within 12 hours. Uttama Matra is the dose of Sneha which digests within 24 hours. According to Charaka Samhita, it is mentioned as Ahoratram Aha Kritsnam Artha Ahamcha Pradikshade Pradhana Madhyama Hraswa Sneha Matra Jaram Pradi. Look, that is Pradhana means Ahoratram, 24 hours. Madhyama means Aha. Aha means 12 hours. Artha Aham means half of this Aha. 12 by 2, that is 6 hours is Hraswa Matra. That is 3 Matra is mentioned by Charakacharya. This sloka you must study and we can tabulate it as this pradhana matra, that is indications and effects. Then it will be more easier for you to study. If you can't by heart this sloka, just you can write it point by point. That is the pradhana matra indications is in habit of taking adequate quantity of unctuous substances. That is prabhuda sneha nitya. Like that you can write in this examination. Okay. Then resistance to hunger and thirst. Those who can withstand this hunger and thirst only we can give this pradhana matra. Then power of digestion is strong enough. Pavakascha uttama bala. Uttama agni bala needs this for this pradhana matra. And the strong persons and gulma, sarpadashta, visarpa, unmada, mutrakrishta, gada varchas, that is hard stools. These are the conditions in which we must give this uttama matra. Okay, indications are prabhuda sneha nitya, kshutpipasa asaha, pavakascha uttama bala, then uttama bala persons. And coming to this effects, that alleviates all ailments instantaneously. Vikaran shamayati. And doshanukarshini means eliminates the doshas, pervades all systems of the body. Sarva marganusarani, then strengthens and rejuvenates the body, sense organs and mind. Balya punarnavakari sharirendriya chedasam. If you can't by heart this sloka, you can write like this in exam. It will be more easier. Okay, if we learn this meanings and all, we can uh, already know this Sanskrit term, no, we can write it like that. Next, coming to madhyama matra, that is indication is boils, eruptions, pimples, itching, that is arushka svoda pidaga kandu pamabhirardita. Then kushtina pramidascha, the indicated diseases are prameha, vadashonida, and those who cannot eat much, those who are having mridu koshta, those with moderate strength. Okay, then coming to effects, that is manda vibramsha means does not create much of the complications, does not affect strength much. Adi nacha adi balaharini, oleates comfortably. Sukhena snehanam, then used for shodhanartha. Then coming to hrasva matra, indicated in elderly and children. Etu vritthascha balascha. Then with tender health. Sukumara patients, persons, Sukojida, brought up in luxury. Evacuating bowel is not good. That is Rikta Koshtatva Mahidam. Evacuation is not good. That is bowel movement is not good. Then power of digestion very weak. Agnibala status is very weak. And then chronic patients of fever, diarrhea, and cough. Chirothida, Jwara, Adisara, Kasa. And weak persons, abala persons, we can give this Hrasva matra. Then what will be the effects? That requires least precaution. Sukha pariharam helps oleation, nourishment. Snehana brahmanam. Then rejuvenates and gives strength. Vrishya balya. Then least harmful means nirabadha, can be continuously administered for a long time. Chiram cha api anuvartade. These are the three matras mentioned by Charagacharya. Then coming to Ashtanga Hridaya, Dvabhyam Chadurphir Ashtabhir Yamir Jiryadi Yaha Kramat Hrasva Madhyama Uttama Matra Tastabhyashcha Hrasiyasi. That is, Hrasva Matra is 2 yama, 1 yama means 3 hours, 2 yama means 6 hours. Then Madhyama Matra means 4 yama, it is 12 hours. Uttama Matra means 8 yama, 24 hours. Also, Ashtanga Hridaya have mentioned about Hrasiyasi Matra. Hrasiyasi Matra is the test dose or trial dose. And according to Aruna Datta, he have mentioned that the quantity of sneha which digests within 1 yama, that is 3 hours, is known as the Hrasiyasi Matra. We are giving this Hrasiyasi Matra to know the Agni Bala, how the Agni is responding to this test dose. And with this Hrasiyasi Matra, we will calculate the Hrasva Matra, Madhyama Matra, Uttama Matra on the consequent days. And according to Sustruta Samhita, Charagacharya, Vakpadacharya, that 2 acharyas we have finished, and this third one is the Sustrutacharya's opinion. Time for digestion and effect indication like this. 3 hours, it is effect is Agni Deepana and indication is Alpada. For Alpadosha persons, the effect will be Agni Deepana if we give the Snehapana for which digests within 3 hours. Then 6 hours, the action is Vrishya Brahmana and indication is Madhyama Dosha. Then 9 hours, it is Snehana. In Bahudosha condition we are giving. Then 12 hours, it is Shamana. Indication is Glani, Murcha, Mada. 24 hours, it is Shodhana. Kushta, Visha, Unmada, Graha, Apasmara. We are giving this 24 hours matra. Then In your syllabus point, it is there Arohana Matra. It is not explained by Brihatrayi. Kalyana Karaka. It is the first Acharya to mention that Shodhana Sneha is to be given in increasing dosage only. Vangasena also mentioned it. Then coming to duration of Snehana. We have finished this dose and next is the duration of Snehapana. Maximum duration is 7 days. Beyond 7 days, it is not intended because it becomes Atmya to the body. Okay. And coming to this Prakarsha Kala. Prakarsha Kala means Snehanasya Prakarsha Saptaratra Triratragau. In Charaka Chakrapani have mentioned that Alpa Prakarsha and Bhuya Prakarsha. That is Alpa Prakarsha means 3 days and Bhuya Prakarsha is 7 days. This depends upon this koshta of the patient. This is the commentary by Arunadatta. You need not study this to just understand only. I have included this slide. Satmi Budohi Kurude na malana mudiranam yedi tu saptahena abhi sniktha lakshanam na utpadyante tada dinamegam vishramya punaha sneho yojaya iti sadvadya. That means we have already learned that sneha prakarsha kala, bhuya prakarsha is 7 days. If we cannot see this samyak snigdha lakshana within 7 days, then we must do 1 day rest and then we can continue the snehapana. Then Delhana, he tells that sneha karyam utkleshanadhigam na karodi ahara vacha satmi bhavadi. If even after 7 days they are not getting this samyak snigdha lakshana, then it will be acting like ahara, like ahara satmya. Also, he quotates this a simile is there. Visham api swalpam pradidinam upayujyamanam na maranatmagam bhavati. If we consume this poison in a little quantity day by day, it will not create death. Likewise, this neha, it will cause only like ahara satmya after the 7 days. You need not study this quotation. And next is time of administration of Shodhana Snehapana. Dose and duration finished, and then when to administer this Shodhana Snehapana. It is beautifully mentioned by our Susrutacharya. Adha Urtham Snehapana Kramam Upadekshamaha. अथ खलु लघुकोष्ठाय आदुराय कृतमङ्गल स्वस्तिवचनाय उदयगिरिशिखरसंस्थित प्रतप्तकनकनिकर पीतलोहिते सवितरि. Means the time of administration is mentioned. Udayagiri Shikhara Samsthita. That is just before sunrise. Okay, that color is mentioned. In the sky, we can see this color of Surya. Then yatha balam tailasya kridasya va matram padum prayachet pita matrecha ushnodagena upasprishya sa upanatko yatha sugam vihare. I will be coming in detail in the Snehapana procedure. Okay, this one you should just study that Udayagiri Shikhara Samsthita Pratapta Kanaga Nikara Pida Lohide Sabidari. That is the time of administration. Also, the patient should be Lekhu Koshta. Then light diet should be consumed. Then Swasti Vachana, they should chant the Swasti Vachanas. And this in this time of sunrise, they should just before sunrise, they should consume this ghee. Next, this is the procedure. We can divide this procedure into Purva Karma, Prathana Karma, and Paschat Karma. Coming to Purva Karma, we must note this Adura Pariksha, selection of medicine, dose fixation, collection of necessary requirements, preparation of the patient. These are coming under Purva Karma. Adura Pariksha, whether eligible or not, we must note whether that the patient is indicated or not. If indicated, which sneha we should give, that is sarpi, taila. Then condition of koshta, already we have discussed the koshta assessment and acne assessment. It must be determined. And also one important factor is mental status. Sattva bala should be examined. For shodhana purpose, we are giving a huge amount of ghee. Then in going on that last day and all, they cannot withstand this high dosage. So the willpower of the subject should be encouraged, And Swasti Vachana, rites of benediction, also confers this mental status of the patient. Then addiction of the patient should be noted, whether the patient is alcoholic or not. That is in contraindicated, that Mada Pidita Madhyasakta is contraindicated. Then investigations prior to Snehapana, that is blood profile should be checked, lipid profile, liver function test, stool, urine, ECG. For what purpose we are doing this investigations? If this lipid profile and all is more high, we can choose this thyla for Snehapana. If LFT, liver function test, are more higher, we cannot go for this Shodhana Snehapana, then we can go for a Shamana one. Like that, to rectify this mistakes and all, we must do this investigations. Then coming to selection of medicine. It is mentioned that Kevalam Paitike Sarpi Vadike Lavananvidam Deyam Bahu Kapechabi Vyoshakshara Samayudam. Means if we are administering in a Vadiga condition, we must mix this Snehadravya with Lavana. In Bahu Kabha condition, we must mix it with Vyosha and Kshara. In Paitiga condition, Kevala is mentioned. In commentary, it is mentioned as Kevalam Asahayam, means without mixing of any Kashaya or Churna like that. Samskritam Asamskritam Va Kevalam Kwatha Churnadi Praksheba Rehidam Sarpi. But Gayadasa, he mentioned that Pittahara Dravya Sathidameva Kevalam Ityaha. We can medicate it with or process it with Pittahara Dravya and give to this Paitiga patients, because in Kevala Paitiga condition, Kevalam Sarpi is contraindicated. Okay, so according to Gayadasa, that it must be processed with Pittahara Dravya. Next is collection of necessary requirements. You must take the sneha, measuring jar, glass, cloth, lemon, cotton, water boiled with shundi is needed. Then Adura Siddhada, that is the Deepana Pajana Prayoga. Importance of this Deepana Pajana Prayoga is to bring this Sama Dosha to Nirama state. Okay, we must do this Shodhana only in a Nirama condition. Okay, for that we must give this Pajana and Deepana before we go to this Snehapana procedure. Importance of Deepana, Pajana and Rukshana. Deepana, in the first class you have detailedly studied this one. Okay, Deepana means kindling or igniting Agni. Hemadri have mentioned that it helps in the separation of doshas from dhatu. Deepana drugs may also perform this Pajana action sometimes. That is why that Deepaniya Gana only is mentioned and Pajaniya Dashaimani is not mentioned by Charagacharya. Also, Deepana drugs acts better on empty stomach and it improves Apyavaharana Shakti, that is intake, capability of intake capacity is more after taking this Deepana drug. Most of the Deepana dravyas have predominance of Lakhu Ushna Gunas. This Panchagola, Pippali Mula, Chavya, Chitraga Nagara is considered as a Sreshta Deepana Dravya. Chitraga, Maricha, Pippali Mula, Jiraga, Deepaniya Gana. These are the drugs used for this Deepana purpose. And coming to Pajana, Ruksha Ushna Gunas are predominant in Pajana. And for the digestion of ama and detachment of morbid dosha from dushya and srotas, it is essential. This Pajana is essential. Then useful in conditions like Ajirna, Grahani, Amavata, etc. In first slide, I have told that Sama dosha to Nirama state, that is before expulsion of doshas from the body, that before Shodhana, it is mandatory for the doshas to be in the Pakwa state. And then increases the Jarana Shakti. Apyavaharana Shakti is increased by this Deepana drug, but Jarana Shakti is increased by this Pajana drug. Then coming to Rukshana, drugs depleting the fat content, moisture content of the body, and which causes dryness in the body comes under the Rukshana. It is used in Mamsala, person of obese, then Medura, muscular body, Puris Leshmano means aggravated kapha, and Vishamakni, impaired acne, Snehojida, who are accustomed to this fats and oils. In that conditions, we are giving this Rukshana. Okay. Externally and internally, we can do. Externally, it is Udvartana with Tribala, Kolagulathadi, etc. And internally, Tribhala, Takrapana is mentioned. Then Yava, chapati made with Yava we can give. Then Shila Jadu, etc. That is the internally Rukshana. Then diet regimen. Which are the diet to be followed during this Purva Karma? Dravoshnam, Anabhishyanti, Bhojyam, Annam, Pramanada, Na Atisnigtham, Asankirnam, Shwaha Sneham, Padumichada. Drava, Ushna, Anabhishyanti, that is no too snigtha and no non-complex. Then excessive quantity of liquid, these all helps in the easy digestion of food and does not remain in this koshta for long period. That is why this diet is recommended. Then Ushnahara also digests quickly and helps in the increasing acne and does Vatanulomana and mitigation of this kapha. Ushnahara. Okay. Then coming to Pradhana Karma. These are the Purva Karmas. What all I have mentioned in Purva Karma? Adura Pariksha, then investigation, selection of medicine, Adura Siddhada, importance of Deepana, Pajana and Rukshana, then diet regimen. These are coming under this Purva Karma. Next is the Pradhana Karma. Shodhanartha Snehapana has to be administered in morning hours. Here you can mention that Udayagiri Shigara Samsthida, Pratapta Nigara, Kanaga Nigara, Pidalohi Desa Vidari. That the time of administration you can mention here also. Then also Hestane Jirna Evane Sneho Acha Shuttaye Bahu. That is when the preceding food, evening food have been digested and then but individual does not feel hungry. That is the time of administration for this Shodhana Sneha. Then if Agni is present, what will be the complication? It will digest the Sneha and the Shodhana action will not take place. Then lukewarm sneha is used in the therapy. The sneha is heated to make it lukewarm by placing it in hot water. And then melted sneha in adequate dose is handed over to the patient seated comfortably on a chair of knee height. And it is better to start snehapana, I have already mentioned, after chanting Swasti Vachana and close the eyes. Some persons, if if they see this ghee and all, they cannot consume it. Okay, for that purpose they can close the eyes and nostrils and just they can use lemon to smell it. Okay, then that aversion of and hesitation of sneha will be not there. Due to odor and taste of sneha, there may be disliking towards sneha and mean he may not cooperate. He or she may not cooperate. Then you can use this lemon and then tying the eyes and all. Then so the suitable method should be adopted. It is better to close the eyes of the subject by a cloth during administration of sneha. Also, you must be aware that the sneha should be consumed as such or not like a sip by sip. If we know the taste and all, we cannot consume it. Next is specific anupana. All snehas except tuvaraka and bilva taila, ushnodaka is recommended. For taila, it is yusha. For vasa and majja, it is manda. Jalam ushnam kride peyam yushas taile anushashyade vasa majjostu mandasya sarveshu ushnamatambuva. For every sneha, ushnambu is indicated. Then during this snehapana, some various digestive phases are taking place. Okay, then we can see this sneha jiryamana lakshana and jirna lakshana. Shiroruja, Brahma, Nishtiva, Murcha, Sada, Arati, Klama, Trishna, Daha. These are the Jiryamana Lakshanas. We can notice while the Sneha or ghee or taila is getting digested, that patient will say that I have severe headache and I am just going to faint, like that. They will tell very much tired. And coming to Sneha, Jirna Lakshana. Jirna Lakshana means this Shirorujadi Jiryamana Lakshana will be gone. That is Shiroruja, Brahma, Nishtiva, Murcha, Sada, Aradi, Klama, Trishna, Daha. And after some time, this Shiroruja will be gone. That they will tell that my headache is gone. Then we can notice that it is the Jirna Lakshana. The Sneha has got digested. Then Vadanulomana, Swasthyada, Kshuta. Then patient will be getting appetite, hunger to eat. Then Trishna, Udgara Shuddhi. If they get this Udgara, the smell of ghee will not be there. They feel like Udgara Shuddhi. Then Lakhuda, feel lightness in the body. These are the Sneha, Jiryamana Lakshana and Jirna Lakshana. Then coming to Samyak Snigdha Lakshana, these are the various lakshanas or symptoms which we can see after the sneha panas, that sneha is getting through different phases of digestion. That is sneha jiryamana, jirna, and then samyak snigdha lakshana, symptoms that represent biological changes at the physical and mental levels. If you check this symptoms, so you can see this both physical and mental lakshanas are there during the process of sneha pana. Also, it is a guiding tool to monitor, continue, and stop snehapana. Look, these are the lakshanas. Vatanulomyam, deepto agni, varchas snigtham asamhadam, mardavam snigthada cha ange snigthanam upajayade. Three acharyas, opinion of three acharyas have mentioned. Any one sloka you can study, and then you must detail it. Vatanulomyam. What is Vatanulomyam? Hmm? Normal gati of vada is anulomana and deeptakni. This anulomana and deeptakni we can combine it. Okay, when agni is good, no, in deeptakni condition only we can get this vata anulomana condition. Then varchaha snigtham asamhadam means snigtha varcha asamhada varcha. That is important features of this samyak snigdha lakshana, that if the sneha is more saturated, then it will not be getting absorbed, and that it will be remain portion will be excreted through this stool. That is the varcha snigtham asamhadam. How we can notice this varcha snigthada? Then the patient, we must ask the patient that after washing, after the defecation, they can feel some oiliness in their hand, then we can say that it is the Varcha Snigtham. Asamhada means non-formed stools. Then Mardavam Snigthada cha Ange. Anga Mardavam, Anga Snigthada, Gatra Snigthada, Gatra Mardava, Anga Lakhava. These are all the symptoms. Also, in this Susrutacharya mentioned that Athastat Sneha Darshanam. It is also very important. Okay. You can study any one quotation, either Charaka or Vakpada or Susruta, and you must detail it. Both physical and mental lakshanas are there. What all are the physical lakshanas? That is Vatanulomyam, Deepto Agni, considering this tool, Varcha Snigtham, Snigtha Varcha, Asamhada Varcha, then Adastha Sneha Darshanam. Also, one clarification for this Adastha Sneha Darshanam is that the Sneha is acting in this Majja Dhadu. That is why the Ubadhadu of Majja is, the Mala of Majja is Sneha. And like that, when it reaches only in Majja Dhadu, the Sneha is formed as a Mala. One correlation is there like that. For this Adastha Sneha Darshanam. No need to write, just for information I told it. Then Asnigdha Lakshana. Actually, these Lakshana may be present prior to Snehana therapy. In that condition, we are doing this Deepana Bhajana and all. Okay. If Snehana therapy is not done properly, then that Lakshana persists throughout the Snehapana. By observing these Lakshanas, physician should rectify these mistakes and carry out Snehana properly. Then Vakpada, Sharngadharacharya, and Chakratatta have mentioned the symptoms opposite to the Susnigdha Lakshana can be accepted as Asnigdha Lakshana. That is Purisham, Grethidam, Duksham, Vayurapraguno Mrudu, Pakta, Karatvam, Rauksham cha, Gatrasya Asnigdha Lakshanam. Okay, sorry, one in this Samyak Snigdha Lakshana, if we do a scratch with a sharp object in the body, if that patient is already have got the samyak snigdha lakshanas, then we can see them some mardava or snigdhada in their body. Otherwise, it will be more dry, rough. Okay, that is the asnigdha lakshana. Pakta, Kharatvam, Raukshyam. In this Gatra, they can feel this Rukshada, Gatra, Rukshada, Gatra, Kharatvam. And this Purisha will be more hard. Hard stools will be there. And these are the Asnigdha Lakshana. Ashtanga Hridaya mentioned it as Rukshe Viparyaya. This opposite Guru Shita Sarasnikta Manda Sukshma Mradudrava, that is in opposite to that qualities, he have mentioned as this Ruksha Lakshana, Adisnikta Asnikta Lakshana. Then by Sustradacharya, it is mentioned as Purisham, Grethidam, Bruksham, Kritsrat, Annam Vipachyade. It will take more time to get digested. Uro Vidahade Vayu, Koshta Dubari Dhavadi. This is the Pratiloma Pravarti of Vada. It is seen in this Asnikta Lakshana. Okay, this by Charagacharya, it is mentioned as Grethida Purisha, Ruksha Purisha, then Vayur Apraguno Mridu. These are the Vada Pradilomada, Pakta, Kharatvam, Raukshyam. These are the Gatra Asnikta Lakshana. By Ashtanga Kridaya, Vakpadacharya have mentioned that Vadanulomnium, Deepto, Akni, Varchasnikta, Asambhadam, that opposite of this Lakshana, Susnikta Lakshanas are this Ruksha Lakshana or Asnikta Lakshana. Then Sustradacharya mentioned like this. Then coming to Atisnikta Lakshana, if Snehana is given in larger doses and continued even after Samyak Snehana, it may lead to increase the water content of the body and Adisnikta Lakshana may manifest. It is told like this. Adisnikthetu Panduttam Krana Vaktra Gudasrava by Acharya Vakpada and Panduda Gauravam Jadyam Purishasya Avipakvada Tandri Rarujir Ulklesha Syat Adisnikta Lakshana. Panduda means what? Not paleness. I have heard one class of Dr. Nambudiri. He have told that this Panduda means if the snikthada of pitta is increased in our body, this Pandu is occurring. Okay, like that. If Tikshnada of pitta is increased, what causes? It causes Atisara. If Ushnada of pitta is increased, that causes Jara. Like that, he have told an explanation. Then Gauravam, Jadyam. If we consume more huge amount of ghee, we feel like more heaviness of the body, more tired, and Purishasya Abhipakvada. It will not get digested and it will go through the fecal matter. Then Tandri, Aruji, Ulklesha, these are the Adisnigdha Lakshana. Then Krana Vaktra Gudasrava is mentioned by Acharya Vakpada. These are the Prathana Karma. Okay. Then Paschat Karma. After intake of medicine, he is advised to wash his mouth with warm water. Varyushna Mache Anupipet. That is for the cleaning of mouth. If anything is rest in the mouth, it should be washed away. Then quietly stroll about. That is Saupanatko Viharet. In this Susrudacharya's quotation, I have told that look, Pita Ushnodagena Upasprisya Sa Upanatko means Upana means with their chapels. Yatha Sukham Vihare. They should walk a little. After drinking this hot water, they must walk a little. Then dietary regimen to be followed during Snehapana. This not only diet, some pathyas are mentioned. This must be followed during Purva Karma, Prathana Karma, Paschat Karma, and during this Parihara Kala also. That is, till the end of Snehana Karma also, strict regimen should be followed. This sloka you must study. If you study this slogan, you can apply it everywhere in every procedures. These are the pathyakramas. Ushnoda kopachari syat brahmachari kshapashaya na vegarodhi vyayama krodha shoka himatapan pravada yana atva bhashya atyasana samsthiti nija aktyucha upadhana ahaswapna dhuma rajamsija ya anyahani pibetani tavandyanyani abhityajet. You can study this. And some pathyas are there. Ushnoda Gobajara means use of warm water because cold water increases abhishanti property which causes hindrance in sneha digestion. Then Brahmacharya, abstinence from sexual activities because it causes Vada Prakopa. Kshapashaya, only night sleep because day sleep enhances Kapha which delays this digestion of sneha. Then apatyas are there. Vegavarodha, Uchchavachana, Shoka, Krodha, Hima, Atapa, Pravada, Vyayama, Yana, Atha, Dhuma, Raja, Divasopna, Ratri Jagarana, Abhishyanti Anna, Ruksha Anna Sevana. Look, this is the quotation by Ashtanga Hridaya. Sarva karma swayam prayo vyadi kshineshu chakrama. One mistake is there. Vyadi kshineshu chakrama. That is, this patya is applicable to every karmas. Next, coming to the sneha vyapat. It is the mistakes of physician and mistake of the patient. Mistake of physician means incorrect dose fixation without knowing this, considering this Koshta and acne. If we fix the dose, it will cause sneha vyapat. Then inappropriate considerations of time factor. That is akala. I have told in the beginning, akala in Shodhana and Shamana, the time of administration is different. We must be aware of that time. Then misarbitration in selection of subject and sneha. If the contraindicated patient is ready for this snehana, they will cause the sneha vyapat. Then if a person having vada pitta prakriti takes sneha in ushna kala at daytime, in that during that previous slides I have told that the person with vada pitta prakriti and in ushna kala, they must do it in night time. If they follow in daytime, what are the complications? Murcha, Pipasa, Unmada, Kamala. Likewise, if a person having kapha prakriti takes neha at night in Shita Ritu, Anaha, Aruji, Shula, Panduda, Urustamba, these are the complications which may occur. Then coming to mistakes of patients. Patients without following this post-operative regimen and instructions, they may cause sneha vyapat. Coming to treatment of Sneha Vyapat, Vamana, Svedana, Lankhana, and waiting until the Sneha digests completely, then Virejana, while by considering the prakriti of the patient as well as strength of the disease. Then Takra, Asava, Arishta. Takra and all are more Ruksha. We are giving for this Rukshana purpose. For this Sneha Vyapat, that Rukshana drugs can be admitted. Then Ruksha Annapana, Gomutra, Triphala, etc. are the treatment of Sneha Vyapat. These are some of the research articles. There is a critical review of Shodhana Snehapana, an open clinical trial to analyze Samyak Snigdhalakshana of Shodhananga Snehapana with Mahadiktaka Kridaim psoriasis. So many studies are there. I have just pointed out this. You can check in the internet. Then a clinical study of physiological and biochemical changes before and after Shodhanartha, that is Gokrida Snehapana. Then also physiological aspects of Snehapana is there. Coming to Sadhya Sneha. It is a procedure of administration of Sneha to achieve Snehana instantly or within shorter duration. It is based on the principles of Vicharana Sneha and we can consider it as a Vikalpa Bheda. Vikalpa Bheda of Vicharana Sadhya Sneha. Dellana, Adamalla, and Chakrapani have commented that Sadhya Snehana brings Snigdha Lakshana quickly on the day of administration itself. Told by these three acharyas. Okay, by Arunadatta, it is mentioned that Sadhya Snehana quickly oleates even within 3 days. That is in the previous slides, we have told that Sneha Prakarsha Kala, Alpa Prakarsha and Bhuya Prakarsha, that Alpa Prakarsha, 3 days, you can connect it with this Sadhya Sneha. For Sadhya Sneha purpose, we can take this Alpa Prakarsha Kala, that is 3 days. Some of the yogas are there, Panja Prasrita Peya, that with this sarpi, majja, vasa majja, taila and tandula is taken and prepared that we can use for this sadhya sneha purpose. Then levana yukta sneha. Salt is abhishyandi, sukshma, aruksha, ushna, vyavai. Levana alone, when it stand alone, levana is not a snigdha drug, but if we consume with the sneha, by this Sukshma, Abhishyandi, Aruksha, Ushna, Vyavai property, it can cause the Sadhya Sneha effect. It can cause the Snehana effect. The quantity of Levana mixed with Sneha should be such that it should not cause excessive salty taste. Okay. Then Sneha, Tilachurna, Fanida, Sneha, Tilachurna, Fanida, Krisara, ghee and Dugda. Normally we are giving this porridge, rice porridge with the ghee for intake as Sadhya Sneha. And 3 times we are giving morning, afternoon, and dinner we will give this ghee. Then indications are Bala, Vriddha, Sneha, Parihara, Asahishnushu. Those who are not able to follow the restrictions of foliation therapy. Then Balahina, decreased strength. Mrudu Agni, Stri Hada, means exhausted by excessive coitus. Vata Pragopa will be there. Then Alpa Dosha, Raja, Rajasama. They are also Sugumara, Sukhojita persons. They can't afford this regimen of this Snehabana, that Patyakrama, this dosage. They cannot afford this. Then contraindications of Sadhyasneha. One thing I want to tell, you want to correct it in the notes. Okay, I have made a mistake in this. Diseases of Kushta, Prameha, Shodha, Sadhyasneha should not be given with Gramya, Anupa, Udaga, Mamsa, Kshira, Guda, Dadi and Tila. I have wrote that should be given. It must not be given, and you can add these points also. Okay, sorry for the mistake. And look, in these conditions, Kushta, Prameha, Shodha, already some Klayada Avastha is there. Already some Utklesha Avastha is there. If we give this Gramya, Anupa, Udaga, Mamsa, Kshira, Guda, Dadi, Tila, all are Klayada drugs. Okay, then it will increase. In that condition, instead of these drugs, what we want to give is the it must be processed with Sneha, must be processed with Triphala, Pippali, Pathya, Gugulu. These are all Ruksha Guna drugs. Pathya, Pippali, Triphala, and Gugulu. Okay, according to disease condition, we must process this uh, Sneha. And this one study about the Sadhya Sneha, a comparative and clinical study of effect of Sadhya Snehana with respect to Samyak Snigdha Lakshanas. Okay, they have taken this Sadhya Snehana, the Kshira Yavagu with ghee in one group, and like that they have compared. Just go through this in the net. Okay. Okay, please correct it. Okay, don't forget to correct it. Here should not be given. In the note I have given us should be given, and instead of this Gramya Anuba Udagamamsa Kshira Guda Dadi, we can use this Sneha process with Tribhala, Pippali, Pathya, Gugulu, etc. Then coming to Shamana Sneha. These are all about this Sadhya Sneha. Then coming to Snehapana. Shamana Snehapana. Are you bored after this class? I will summarize in the last. Okay. Coming to Shamana Snehapana. Administration of Acha Sneha in different disorders with an intention to normalize the aggravated doshas without expelling them and disturbing the equilibrium of normal doshas. That is, the main aim of the Shamana Sneha is the Vyadhi Mardava, not Utkleshana. It pacifies the dosha as well as the roga. It will not result in Prachala or Utklesha state of the doshas. Okay. Then Shamana Sneha is administered when the food taken on the previous day is digested during the Annakala when one feels hungry. I have again repeated it because it must be in your mind. Otherwise, Shodhana and Shamana, what is the difference and all? You must be very much thorough with this. Then only if it is asked in exam, no, you can write it clearly. Okay, during Annakala, when one feels hungry, we must consume this Shamana Sneha. In Shamana Snehapana, there is difference from Shodhana Snehapana in the duration, time of administration, dosage of Sneha Dravya. Duration for this Shodhana Dravya, Shodhana Snehapana, we are giving it for 7 days or up to the Samyak Snigdha Lakshanas. But in Shamana Snehapana, up to Vyadhi Mardava, till Vyadhi Mardava we are giving. Then time of administration, already I have told, in Hyastane Jirna Evane, Sneho Acha Shuddhe Bahu in Shodhana, Shamano, Ananno, Matya Matrascha Shasyade in Shamanaha. Then dosage of Snehadravya is also different. This quotation, any one sloka you can study. Then Pibet Samshamanam Sneham Annakale Prakamshida. Like that, Acharya Charaga mentioned. During Shamana Snehapana, Pathya and Abhatya prescribed for Virejana are to be followed. Upacharastu Shamane Karyaha Snehe Viriktavat. Comparison between Shodhananga and Shamananga. Shodhananga we are giving before appetite, Shamananga at the time of appetite. Then abrupt increase in the dosage is in Shodhananga. Only gradually we will increase in Shamananga. 3 to 7 days Shodhananga duration until Vyati Mardava is the for Shamananga. Samyak Snigdha Lakshanas as per the classics is the time limit for Shodhananga. But Vyati Mardava is the time limit for Shamana. It should not be Satmya. For Shodhananga, already I have told that if after 7 days it will become like Aharavat Satmya or like that poison, it will become. Okay, then Shamananga, it should be Satmya. In Shodhananga, we can use Asamskrita Tiladaila or Asamskrita Krida, but in Shamananga, we will use only Samskrita Tila, Samskrita Sneha. According to Vakpadacharya, the matra of Shamana Snehapana is Madhyama matra, that is, which get digest in 12 hours. But according to Charagacharya, what is the matra for Shamana Snehapana? It is Uttama matra. Vakpada and Charaga have told in opposite manner. Okay, Vakpada told us this Shamana Snehapana is Madhyama matra, Shodhana Snehapana is Uttama Matra. But Charaga told in opposite way. Shodhana Sneha is Madhyama Matra, Shamana Sneha is Uttama Matra. I think it is clear. One commentary is there in that is Sridasa Pandita in his Hridaya Bodhika commentary opines that this Uttama Matra can also be made use for Shamana Snehapana. That is, in Avapidaka Snehapana, it can be considered as an Uttama Matra Snehapana, and in this commentary, Sridasa Pandita opines that. Just keep in mind, no need to study. In Padartha Kaumudi commentary, in addition to Madhyama Matra, both Uttama and Hraswa Matra are indicated for Shamana purpose depending on the dosha kopa. Also, Charagacharya have mentioned that we have already discussed that Uttama Matra effect, no? Shikra Vikara Shamana. Then Shargadaracharya mentioned one Pala Matra for Sneha in context of Sneha Kalpana. This is for Shamana Snehapana purpose. It is one Pala. The effect produced by Madhyama Matra Snehapana is largely based on the time of administration. Again, I am telling the same thing. If used in early morning, it produces doshotkleshana, and if used when hungry, it pacifies the dosha. I think it will be clear for you now. Then indications of Shamana by Acharya Charaga we have already discussed. Gulma, Sarpadashta, Visarpa, Unmatta, Mutrakrishta. These are the conditions. Then Vangasena told to avoid this Abhishanti Ahara, Ruksha Anna, Diva Swapna during this Shamana Snehapana. And Ashtang Hridaya, while commenting Ashtang Hridaya, Arunadatta told that Shrut occurs within one yama after taking Shamana Sneha. His opinion is that then according to Chakrapani, Shamana Sneha should always be administered in Shuddha Koshta only, and otherwise it will lead to aggravation of disease. You can write by according to Chakrapani. In exam point of view, you can write according to this Acharya, according to Chakrapani, according to Arunadatta, like that. You can write point by point. Okay. Then duration of Shamana Snehana is still Vyadi Shamana. Then coming to Brahmana Snehana, the administration of Sneha along with Mamsarasa, Madhya, Bhakta, etc. is Brahmana Snehapana. Dose should be Alpa and it is given for the nourishing purpose of the body. Brahmana purpose we are giving. Bala, Vritta, Pipasartha, Sneha Dveshi, Madhyashila, Stri Sneha Nitya, Mandakni, Sukhojida, Krisha, Biru, Mrudukoshta, Alpadosha, Ushnakala. These are the indicated conditions. Brahmano Resa Madhyadi, Sabhakto, Alpa, Hita Saja, Bala, Vritta, Pipasartha, Sneha Dvit, Madhyashilushu. These are the indications of Brahmana Snehapana. It should be consumed either with Mamsarasa, with Madhya, that is, we can give in with Arishta, that is Madhya form. No? In mixed with Ahara, like that, we can give. Relation between Brahmana Snehapana and food. Prak Madhya Uttara Bhakto Asau, Atho Madhya Urtva Dehajan. Vyathin Jayet Balam Kuryat Anganam Cha Yathakramam. That is Brahmana Sneha given before food, with food, and after food. That is Atho, Madhya, Urtva. It will uh, reduce the diseases or cures the diseases of Atho, Madhya, Urdhva, Dehajan. If we consume, that is, if we consume this Brahmana Sneha before food, it will be good for Atho body or the Atho Deha of the patient. If we give in Madhya form, it will be good for this Madhya Deha of the person. And in Uttara Bhakta means it will give Urdhva Deha cure of the body. Then duration of Brahmana Sneha is still Samyak Brahmana Lakshanas. It is mentioned in Ashtanga Hridaya Sutra. Go through it. Then Charagacharya considered Hraswa Matra as having Brahmana, Snehana, Vrishya, and Belly action. Already we have discussed that. Then diseases enlisted are pertaining to this Abhyantara Roga Marga, such as chronic Jara Adisara Kasa, Chira Samuthida, Jara Kasa Adisara. And these, we listen or we consider this site of dosha of this Jara Adisara Kasa, these are all related to this. This dosha dushti is all related to this koshta, within the koshta. Hence, minimum dosage will be sufficient to cause snehana action in these conditions. Then coming to avapidaga sneha. The word avapidaga implies the meaning of either pidana of dosha or the pidana of ahara. Okay, pidana means pushing down of dosha or pushing down of ahara. In between, we are giving ahara, that is annava pididam cha matya bhojana pidam kridam pavadi. This snehapana, this avapidaka sneha is not at all practiced widely, and so different opinions are there. Okay, different debates are there for of this avapidaka. I have included in this slide. Just go through it. Okay, the sneha given at the middle of the meal gets pidana by food is called avapidaga sneha. It is mostly indicated in Mutra Janya Vigara. Mutra Jeshu in Ashtanga Sutra, Rogolpadaniyam, Roganulpadaniyam, we can go through this. Mutra Jeshu tu panecha prak bhaktam shasyade kradam, Jirna andigam cha uttamaya matraya yojanadvayam, avapidaga medacha. That is special pattern of oral administration of sneha in two kala at a stretch. That is, one is prak bhakta, before food and after the digestion of food. Prak bhakta means we will give hraswa matra in minimal dosage before food, and after the digestion of that food we will again give another dosage. That will be the maximum dosage, uttama matra. By giving the hraswa matra, we will calculate, or by giving this hrasiyasi matra, we will calculate the trial dose, and the next day we will give the hraswa matra as prag bhakta, and then after that food, after that ghee get digested, the patient is advised to take food, and then after that food get digested, the uttama matra sneha will be given. Indications: Mutra Vegarotha Janya Vigara, that is management of diseases due to suppression of micturition reflex. Mutra Udavarta Chigilsa, Athona Apigada Vada Chigilsa means in Arsha Chigilsa also it can be done. Okay, as a Rekta Stambhana Chigilsa we can give. Then Pitta Anilamayakna, it pacifies Pitta and Vada dosha. It has a special affinity towards bladder, thighs, and lower back. That is why it is Athonabhijanya Vigara. In Apana Vayu Vaigunya and all, we can give this Avapedaka Snehabana. It is Vrishya in nature. Some methods I will discuss with you. Method 1 is by early evening, Sneha is given in Hraswa Matra. That is, in the today, consider today evening we will give sneha in hraswa matra, and then we will be asked to take food by the patient, and let the patient sip hot water till he or she sleep. That is, that ghee must be get digested. Today we are giving the sneha in hraswa matra evening. Then the next morning, what, after ascertaining the jeerna ahara lakshana, status of the digestion of the food, we will give uttama matra when during Suryodaya Kala, that is in that time of Shodana Snehapana Kala, we will give this Uttama Matra. And then before feeling of hunger of Uttama Matra, that Snehapana is administered. Sneha is administered. Okay, this is one method. That is, by evening we will give sneha in hraswamatra and food is administered, and then next morning during the time of sunrise or just before the sunrise we will give the uttama matra again. Okay, another method is during sunrise. Next morning Snehapana is administered in Hraswa Matra and Satmya Ahara is given after 30 to 45 minutes. And time of administration is significant as it is the ideal time for Utklesha. And after that digestion occurs, the Jirnahara Lakshana, and when hunger is felt, Uttama Matra is calculated. That you will be more doubtful after hearing this and all. I have just included, you can just go through this research. Okay, a critical review on the concept of Avapidaka Snehapana, a special mode of lipid administration by the Kadambari and all. From this, I have taken this. Okay, you just go through this. If any doubt, you can ask. And a brief review on Avapidaka Snehapana principles and practice. These are in this article. They have mentioned this different methods. Okay, method one, method two, that is during sunrise they are giving the hraswamatra, and then after digestion of the food, then they are giving this uttama matra. Then only hraswamatra is mentioned. If the condition is not severe in abarasatha or alpa bala patients, we can go for hraswamatra, not for that uttama matra. Okay, then uttama matra, if we know this agnibala of that patient, we can give this uttama matra. Okay, this much are the points. Okay, we can summarize it. Am I audible now, doctor?
Yeah,
Anyone,
doctor,
please?
you are audible.
Okay, okay. Then Abhyandara Snehapana, what we have today discussed, indications and contraindications of Sneha, we have discussed. Then determination of Koshta. Indications, just I will tell one more. Indications, Svedya Samshodya, we have tabulated it as Purva Karma in disease condition, according to constitution. Then contraindication in Mamsala Medra in Rukshanarha, we must not give Snehana in Dattavasti, Datta Virejana. After Shodhana, already the patient will be more, the body of the patient will be more weak. And if again, if we give this Sneha, they can't withstand the Snehapana. And then determination of Koshta and Acne, assessment of Koshta. We have considered some points regarding this frequency of stool, consistency, that then efforts, training efforts, then previous encounters of diarrhea, anything like that. And we can come to a questionnaire like that, Krura Koshta, Mridu Koshta, Madhyama Koshta. And then coming to this Acne assessment, how I have told an Aknibala index after considering this Apyavaharana index, that is test dose by given dose into time taken for digestion of ghee, we can come across this Aknibala index. Also, this Koshta is dependent upon what all factors? This duration. Alpa Prakarsha, Snehana Prakarsha Kala is dependent upon this Koshta. 3 days Alpa Prakarsha, and Bhuya Prakarsha means 7 days. It is mentioned like that. Only by considering this Koshta, we can come to a conclusion of this duration. Coming to Agni, we are if we are not considering this Agnibala status and we are giving this Sneha, it will cause complication. Okay, we may make mistake without this Agnibala status, without knowing this Agnibala status. Okay, this Aknibala index I have told, test dose by given dose into time taken. Then if what was the interpretation? Lesser the Aknibala index, that more will be the Agni Deepti. Okay. Then which Sneha we should take? And Sneha Paga, Madhyama Paga by Charaga, Vakpada and Shargadaracharya, Mridu Paga by Susrudacharya. Then dosage and duration. Dosage, different matras according to Charagacharya, Susrudacharya, and Ashtang Hridaya. I have mentioned this dosage. Then duration also I have mentioned. Uh, Then time of administration, beautifully mentioned by Susrutacharya. You must study that quotation. Athakalu Lagukoshtaya Aduraya Kridamangala Swasti Vajana. You must study that. Then procedure, Purva Karma, Prathana Karma, Paschat Karma, everything you must study. Then after this digestion of Sneha, some digestive phases are there. That is the Jirna Lakshana, Jiryamana Lakshana, Samyak Snigdha Lakshana, Asnigdha Lakshana, Adisnigdha Lakshana, and there are some diet and pathyas to be followed before Purva Karma, that is during Purva Karma, Prathana Karma, Paschat Karma, and till the end of the Snehapana and also Shodhana. Okay. Shodhana finished, and Shamana Snehapana. What is the difference between Shamana? During appetite, we are giving, till Vyadhi Mardava, we are giving, and one pala is mentioned by Arunadatta and all. Then Sadhya Sneha, that is three, Alpa Prakarsha, that is 3 days. Mentioned by Arunadatta, Samacharyas, Adamalla, Delhana have mentioned that instantly or instantaneously within 1 day they get the desired effect of snehana through this sadhya snehana. And then some yogas are mentioned: pancha prasruta yoga, lavanobahita yoga. Lavana yukta sneha is a very much effective sadhya sneha. And then brahmana sneha, then also indication of sadhya sneha, indication, contraindication have mentioned. Then brahmana sneha, avapedaka sneha, all are I have mentioned. And that is the end of this session. Thank you.